I'm Robin Targaryen. I'm I'm 48 and I've been a service user for quite a long time. I went I went to Rampton Hospital initially in 2005 as part of the DSPD era. And in case people are wondering what that is, it was the Dangerous Severe Personality Disorder. So I got sectioned to Rampton from Franklin Prison in 2005. I spent 18 years in Rampton because after I was on the DSPD for a number of years, I got re-diagnosed as a learning disability, having a learning disability, and then I basically went on to the learning disability unit, and I went on a ward which was called the Therapeutic Community Ward. So that was all focused on like recovery, treatment, groups, things like that. And altogether I was in Rampton for, like I say, 18 years. So I was there a long time. But then eventually, I think it was around 2022, I got my gatekeeper's assessment. I got assessed and they thought I was ready for medium secure. And then in 2023, March the 27th, I've moved from Rampton to Brooklands. And at Brooklands, I was on a 6-month trial leave, so I was still a Rampton patient for 6 months. But I'd done my 6 months trial leave here. That went okay. And I've been at Brooklands now for about a year and a bit. I've benefited in the sense that it's now helping with my recovery, because obviously soon as well I should be stepping down from medium to low by the end of this year. And also since I've been here, I've achieved, like, I've got ground leave, I've got community leave. So in the sense of recovery, I've come a lot further than I was when I was in Rampton.
You've also been able to experience the positive things, haven't you?
Yeah.
So, when's the last time you had a title like before you come here?
It was like nearly 20 years.
I think I'd have so excited when you had that title I bought it.
Yeah.
They're the things that you can say.
Yeah.
Coming here, it's helped in recovery, but I've also been able to go out to the shop, which I wasn't able to do when I was in Rampton. I've been able to have takeaways, which I haven't been able to do in Rampton.
Yeah.
What's the other stuff that you've bought? And you've like, I haven't seen that in 20 years. There was something else that you bought.
I know this sounds mad, like, but I brought what was it I brought now? Yeah, I brought even simple things like buying tea cakes. Like yesterday, I haven't had tea cakes for years.
Yeah.
So little things like that are really bringing me happiness because, like I say, because I haven't had them so long. The staff are very supportive here because obviously there was an old saying in Rampton, you could tell the staff that just turned up for the pay packet, and you could really tell the staff that generally wanted to be there to care for patients. But more so here, you find that the staff really do want to help you.
Would you recommend the services that you've experienced?
Definitely Brooklands.
Do you feel like you're treated as an equal here with like the staff? So if the staff come and talk to you, they'll ask you questions, like myself, we'll come and ask you questions and work with you as an equal person. Do you feel like you're being treated equally?
Yeah, yeah.
And how do you feel about the future now?
Quite positive, because another thing that I do here that's pretty good is I do the Good Lives group, and the Good Lives group is basically about focusing on a future that is a lot healthier than you did when you were last outside. So like you're looking at all the positives that you can achieve. So that you're like looking at like your goals, your values, things like that. The other thing about me being a service user, I have technically been in the psychiatric system since I was about 17, because I first went into like the community psychiatric hospitals in Coventry, and that was mostly because of my self-harming. And my first section that I was in Walsgrove Psychiatric Hospital in Coventry, And basically the first section I was on one where I could go out in the day, but I had a curfew where I had to go back to the hospital at night. So all day I could go out, so I used to just go to my foster mum's like for Sunday dinner and things like that. So I have been a service user for quite a number of years.
Do you feel that service helped you?
It has, yeah.
And do you think that you would require more support when you go back out into the community? So rather than being left to your own devices in the day, is there something that you think that Brooklands could help you look for a package?
Well, my doctor, Dr. Borer, has already told me that when I eventually do go to the community, he's going to be looking like for supported living, so that in other words the support's going to be there in case that I need it. Because obviously I have been away a number of years.